Hey guys, today we're going to talk about Paws and Paw Health with Max. He's pretty excited and he's not too bad with having his paws touched, and that's probably the first thing you want to think about with your dog is actually getting them used to having their paws touched. So you sort of grabbing each digit, getting in there in the interdigital space and just getting them used to, after a walk, especially when they might have got something stuck in there, getting them used to you touching their paws. Can you give them treats? I'm going to give him a treat anymore. He's used to it, but he's still going to get a treat. Look at that, he's into it. Let's talk about a few things we want to check on the paws specifically. So one thing that you can do is have a good look in these interdigital spaces in between the toes. This is a classic area in here where they're going to get grass seeds. Okay, sometimes splinters, but often grass seeds. They'll jam in on the top part of the paw, right in that space, in that V between the digits, in these spaces here. So you want to check, if you've been walking through long grass and stuff, often you'll find a grass seed that's just jammed in there that you can still grab and pull out before it's worked its way right into the skin. So that's a good place to check. Some dogs with really, really hairy paws, if they're prone to grass seeds, it's a good idea to actually trim the hair through here throughout the summer to keep the hair short so it's less likely to catch. Let's talk about nails. Okay, so what you want to do is you want to make sure that the nails are not too long. You don't want them to have like a hook on them that they can get caught, they can catch that hooked end on things and rip the nail and damage the nail. You also don't want the nail long enough that they're weight bearing on the nails. They're not meant to. As they sit and press on the ground, the nails should be just lifting off the ground as they put weight on the pad. So if they're weight bearing on their nails, it can be quite sore. So in those situations, you want to cut the nails yourself or get vets, get your nurses to help you to make sure that you're not cutting those too short and hitting them quick. Another thing you want to check with the paw is, at some point, you want to have a look under the paw. You want to get under here and have a good dig around. There's the main pad area under here. It's got all the little digit pads. And then there's a lot of space here between the main pad and the toe pads. And often things will get stuck in there. This is a classic area for a splinter. You might see a little puncture hole. You might see a tiny bit of blood. You might see a tiny bit of discharge coming from a tract where a splinter's been, so you can check for that under there. Also, obviously, you might find focal pain. So if your dog's a little bit lame and you're not quite sure where where it's hurting him, you can start to apply a little bit of pressure to different areas of his paws or her paws to localize it, and you might get a repeatable single area where, hey, he's reacting to quite a bit, and that's where you can focus your investigations to look for. It could just be like a bitty bit, or a little piece of stone or something, or it could be a splinter in it. So one of the things that you want to be checking the paws for is actually areas of red, thickened, inflamed skin, because of course, whatever they're standing on, they're getting direct contact with the skin in this area. And usually you'll see it worse underneath the paws, in between the toes and the stopper pad, and the main pad. And if you see areas of redness under there, then sometimes you can apply soothing creams, antibacterial creams. If it's really nasty, sometimes you need your vet's help to use medications to settle down contact allergies or contact reactions to something that's a little bit caustic that they might have stood on. For example, if they're standing in a puddle that's got some weird chemicals in it, or if they're perhaps standing on a plant, a grass that's been sprayed with some herbicide or insecticide or something like that, that can react to an actual product. Sometimes it's a severe allergic reaction to an individual plant, like say wandering Jew or something like that, one of those creeper plants that can really almost burn the skin. So sometimes the only sign you'll see, rather than being able to see a lot of redness or changes in the skin, particularly because we've got this beautiful fur covering the skin, it can be a little bit hard to pick it up. What we'll often see is just that the dog is bothering a particular area or worrying a particular area, chewing part of his paw, chewing underneath, chewing on the top, chewing in between the digits in the front here. And that'll often alert you to a particular area that you need to have a good look at for skin reactions, for the presence of something that shouldn't be there, like a splinter. So sometimes your dog will guide you to the specific spot, and you'll see that one part is very wet from his saliva and potentially even discolor it. If they've been chewing and licking it quite a bit, the saliva will actually discolor it further. So sometimes you'll get an actual injury to the paw. We can get nail injuries, we can get them caught on things and pull them and lift the nail either completely off or partially. If the nail's still partially attached, it can be very, very sensitive because it can wriggle around and cause quite a bit of pain in the nail bed. Sometimes we'll see nail bed infections, and in those situations, the actual digit itself, the toe, will swell up quite a lot. And you'll see a thickened toe. You can compare it to the same digit on the other side of the foot. That really helps you to realize, oh, it's actually really, really swollen. And that'll happen with nail bed infections, and bone infections as well. Sometimes infection will drive in around the base of the digit, around the nail bed, or through a penetrating wound, and then start to take off in the bone itself, and you'll see a lot of swelling with nail bed infections and with bone infections. Now, obviously, with both of those situations, you need to get your vet to help. You need to get onto some really good antibiotics that will penetrate in there and take care of that. Sometimes we x-ray the foot as well. Sometimes you'll get cracks through here in the metacarpals, so you can get little hairline fractures. Usually the dog will be very sore, and as soon as you apply a little bit of pressure, a little bit of a squeeze, you're going to get a reaction, and you're going to know, hey, unless my dog's really, really good at acting, it's probably got a significant injury and we want to take it to the vet and get help. Some dogs will have a mild grass allergy or plant allergy that can be seasonal, comes and goes, creates a little bit of redness underneath the paws and in between the digits. Sometimes they'll have a little bit of a chew or bother it, and other times they'll kind of ignore it and it'll be fine. And in those real mild situations where you're trying to manage a condition, you can't get rid of it completely. You know, it might not be always a situation where, as a vet, we're going to recommend, prescription medicines, because we're obviously weighing up the positives with, do we really need it? Is it bad enough? And in those situations, it's a good idea to have something on hand that you can use that's got a natural anti-inflammatory properties, natural soothing, natural calming for the skin, like a balm or a cream or something like that. And if you keep on top of that and kind of settle it down before your dog gets a chance to do too much damage and get into a real cycle of self-paw mutilation, then sometimes that's a really good way to stop having to use as many medicines, as many drugs to get on top of these conditions.